So my son was diagnosed with adenotonsileitis. Adenoid is a growth in the nose that tries to block the airways, while tonsillitis growth is a bacteria in the tonsil. So it causes a lot of fever, snoring and cough and catarrh. Like right here in this video, this was the first time he was admitted in the hospital because of this. He started having constant fever, like in a month. I'll have to take him to the hospital almost 2 or 3 times a month because of fever. High fever, very high fever that ordinary medication won't stop except he takes a good antibiotic for it. So it made me to be taking him to the hospital regularly, like we go for routine checkups. So we ran some tests. This was the day we started going for the tests. We did an x-ray and they saw that the adenoid is really progressing and the tonsillitis is in the 3rd stage. So they recommended a surgery. This was when we did the ECG, when we were preparing for the surgery. With the constant fever, the cough and catarrh, my chubby baby became so lean, like he was so lean. And at some point, like I became so depressed because almost every week I get calls from the teachers to come to the school to come and pick him because he's running temperature. Like this became a constant. Like my mind is always where he is whenever I'm not close to him, whenever he goes to school. Like I'm always wondering, how is my son doing in school? How is he? Because of the constant fever. Like he will be fine this minute, the next minute you check his temperature is very, very high. Please, parents, whenever you notice any of these symptoms in your child, take him or her to the hospital. Okay, it's very, very important. Don't ignore every cough or catarrh that your child is having. Okay, this might also make your child to start snoring. But I just thank God the surgery was a success. This is the waiting room in the theater. So I was called in immediately after the surgery to come and stay with him. So I was just there with him, holding him so that he doesn't cry much because he was crying. He looked around, he didn't see me, he started crying. So I was called in to come and stay with him after the surgery. My boy was just lying down there in pain. This was what was brought out of his nose and mouth. This was what the doctors brought. So they said we should take it to the lab where it will be tested. Yes, they said we should take it to the lab so that they will get it tested to make sure there is nothing to be worried about. So this is us in the theater still. We're just waiting there. They are checking his vitals, making sure that he's stable before they can move him to the ward. Okay, immediately we got to the ward that day. I was asked to give him ice cream, which I did. Throughout that day, what he had was I kept giving him was ice cream and yogurt. Yes, until the next day I made pap for him. This is the next day. Yes, a day after the surgery. And as you can see, he's fine, healthy and strong. Finally playing. Okay, I gave him pap, he had his pap, and we were discharged that same day. This is us in the car, ready to go back home. As you can see, he's happy, he's smiling, no more pain. He wasn't even feeling that pain anymore. Like this God is miraculous, he's wonderful. Okay, look at him. Who would have believed that he went into the theater few hours ago, like a day before that day? I just thank God. This is my son right now. Like he's very, very strong and healthy. This is 4 months after the surgery. Okay, like no more snoring, no more coughing, no more catarrh. At least the cough and catarrh reduced a lot. Like it wasn't that consistent anymore. Since you know it's a flu, it comes and goes. And now no more fever. Like this is 1 year after the surgery. No fever, no calling me to come to the school and pick my son. May God's name be praised and let his healing remain permanent in Jesus' name. Amen.